Good afternoon. I'm United States Attorney Zachary Cunha. Thank you for joining us. We are here this afternoon because the state of Rhode Island has failed miserably and repeatedly to meet its legal obligations to children with mental health and developmental disabilities. As a result of what I can only characterize as this appalling failure, children, particularly teenage girls, rather than receiving the home, foster, or community care that is appropriate to their condition and required by the law, have been warehoused at Bradley Hospital, an acute care psychiatric institution intended for short-term admissions. This is the conclusion that we have reached after an extensive and thorough civil rights investigation conducted by my office in partnership with our colleagues at the Office of Civil Rights for the Federal Department of Health and Human Services. As a result of this investigation, we have today issued a detailed letter of findings to the state, specifically to the Department of Children, Youth, and Families. You should all have a copy of that letter in front of you. But before I walk you through our findings and the allegations in that letter, I'd like to introduce Susan Rhodes from HHS, who you'll hear from shortly. She is standing in for Office of Civil Rights Director Melanie Fontes-Rayner, who had hoped to be here today but has been unexpectedly detained in Washington. We're grateful for your partnership. I'm also joined by Assistant U.S. Attorney Amy Romero, who led this investigation on behalf of the Justice Department, and Aaron Walker from HHS, who also played a key role in this inquiry. Fundamentally, what we found here is not complicated. Under Title II of the Americans with Disabilities Act, there is a clear legal obligation on states to provide services and programs for individuals with disabilities in the most integrated setting appropriate to the individual's needs. This is not a new concept. The Supreme Court made it clear over 20 years ago in a case called Olmstead that states must provide community-based services when they're appropriate. Section 504 of the Federal Rehabilitation Act imposes a similar requirement, about which you'll hear more in a few moments from my HHS colleague. It is the finding of our investigation and our allegation today that the state failed to meet that obligation, not in isolated instances, not sporadically, but repeatedly, unjustifiably, and with dire consequences. Our investigation focused on a 5-year period between January the 1st, 2017 and September 30th, 2022. In that time, 527 children in DCYF's care were admitted to Bradley for short-term stabilization care. Those are inpatient admissions for kids in crisis that are supposed to last 1 to 2 weeks to stabilize an emergency. We found that the actual average length of a Bradley hospitalization for children in DCYF care was 51 days, but that's only the average. Of those 527 kids, 116 were hospitalized on a single admission. In other words, this measurement doesn't lump together multiple hospital stays. 116 were hospitalized for more than 100 days. 42 were hospitalized for more than a year. And 42 were hospitalized for more than 180 days. And 7 were hospitalized for more than a year. Each of those days is time with no meaningful access to family, friends, the comforts of a home, the chance to play outside, to go to school, to be a kid instead of a patient on a locked ward. On top of that, almost 40%, or 197 of these 527 children, were hospitalized at Bradley more than once during the period we looked at. Taking multiple stays into account, the average length of stay works out to 92 days per child. One girl, who was 9 at the time of her first admission, spent a total of 826 days across 5 admissions during the period we looked at. Another, who was first admitted at age 14, had 11 separate admissions for a total of 706 days. And 5 kids we looked at were only 4 years old at the time of their first admission. One of those kids was hospitalized for 126 days over the course of 5 years. Before I go any further, I would also like to make one thing clear. We are not alleging any wrongdoing on the part of Bradley Hospital whatsoever. Inpatient psychiatric services for kids in crisis can be critically important in terms of medical care, and we are not alleging that Bradley does that work in any manner other than appropriately. We're not alleging that they billed inappropriately, and we're not taking issue with the quality or nature of their care. In fact, in many of the instances that we examined, Bradley staff recommended unequivocally that children be discharged to family care settings, including therapeutic foster care, only to have that recommendation go unfollowed by DCYF. The fault we find in this investigation rests with the state and the state alone. While we appreciate the fact that DCYF has been cooperative in our investigation, we are here because larger systemic failures have led to a situation in which children with disabilities, rather than receiving the integrated community care that they need, are being warehoused unnecessarily. The state knows how to provide this care. Our investigation found that DCYF has programs that can and should provide community-based care, but that it fails to adequately support or devote resources to those programs to make sure they are accessible and maintain needed capacity. Programs like community-based clinical and wraparound services, crisis services, and therapeutic foster care. Too often, we found, DCYF failed to build and maintain capacity in these programs, failed to plan and implement discharges appropriately and effectively, and as a result, failed to meet the needs of these kids. In the case of therapeutic foster care, for example, the state made changes to the way that it compensates caregivers in a way that actually cut those critical services by roughly half, rather than maintaining or expanding them. If you have children, it's not hard to envision how devastating what we found here is. Frankly, if you have empathy, it's not hard to envision how devastating this is. The thought of a child being kept locked away when they don't need to be, and unnecessarily separated from family and friends and loved ones, is wrenching and horrific to contemplate. To think that instead of the daily love and support and warmth that kids need, to think that instead of having the opportunity to receive care and comfort in a loving home, or properly supportive therapeutic foster care, or in their own community where their friends and family are, to think that too many children with mental or developmental disabilities have been treated as something to be relegated out of sight in a psychiatric facility, it breaks the heart. And more to the point that we're here for today, it breaks the law. When it comes to children in these situations, short-term care to stabilize kids in crisis can be vital, but short-term means short-term. For too long, our investigation has concluded, the state has failed in its duty to these children by failing to fund and support the integrated community services that are needed to provide the care that these children need and are entitled to under the law. No child entitled to mental health or behavioral services whose needs can be met by therapy at home or in their community, no foster child whose condition can be addressed with properly funded therapeutic foster care, no child whose mental health needs can be met by short-term community crisis care should be left indefinitely in the segregated setting of an institution. The state must do better by some of the most vulnerable among us. Our findings today call on the state to do precisely that, and they serve notice that if the state does not, we will hold them to account.